Are you starting to feel under the weather during this cold season? If so, and you're one of those folks who might ask for a prescription of antibiotics right away, you're going to want to stick around because we're going to find out why exactly that could be a matter of life and death, and that is no joke. We're going to be joined by Director of Pharmacy here at Mile Bluff Medical Center, Craig Griffiths. Also, Nick Hewitt, who is the infectious disease pharmacist, and physician's assistant Brad Ingram. From the Mile Bluff Medical Center here in Mauston, I'm Justin Riley, and this is Wisconsin Doctors. Welcome back to Wisconsin Doctors. We're at Mile Bluff Medical Center, and we're discussing a topic that just keeps coming up again and again because it is so very, very important. I have a great panel of folks joining me here today to talk a little bit more about antibiotic stewardship. So welcome everybody to the show.
Thank you.
Thanks, Justin.
Good to have you with us today. So let's start with the basics. What is antibiotic stewardship?
Well, antibiotic stewardship essentially is what it says it is. It's the prudent use of antibiotics. But for us, that means the right antibiotic for the right patient, so they've got a reason to have an antibiotic, and for the right duration of time, so that we do things appropriately, use the antibiotics the way we should for each patient.
Very much so. Let's talk about why that's so important, because a lot of people just want to get their antibiotics because they think that's going to make them better. So why is that important? Why is the stewardship so necessary?
Well, antibiotics resistance has become the world's largest health problem. And with the use of antibiotics, we're creating bacterial organisms that attack the human body that we are in a situation that we cannot fight off with standard or even more advanced antibiotics. There are patients that currently die because there are no antibiotic choices for.
Wow, because none of the antibiotics that are being prescribed for them are working for them because they've grown the bacteria have grown resistant to that.
Right, and we call those bacteria superbugs.
Yep. So what exactly, how exactly is that caused, the antibiotic resistance?
When you end up with what the media calls superbugs, or medical people call multi-drug resistant organisms or bacteria, it's the old adage, if you hit something on the head so many times, it's going to start to duck. Right. If you keep treating a bacteria with the antibiotic and you either don't kill it all off or you treat it with an antibiotic that isn't going to kill it effectively, it will adapt. It will become resistant to that through a couple different means, using its genes and plasmids, which gets a bit technical, but basically just becomes resistant to it. That antibiotic will not kill that bacteria anymore, or it will only weakly kill it. And it becomes a problem as it goes on. That's why stewardship with antibiotics is important, because that way we are not using antibiotics all the time where we're really selecting out those resistant ones. And we're making sure we're using the right one for the right infection so that we don't end up with a superbug by accident.
Right, exactly. And now, this might be a little bit too technical of a question, but I just got to know, is that kind of a mutation? I mean, are they literally mutating when they become superbugs?
Some are and some aren't. Yeah,
Okay.
some are just mutations because bacteria replicate so quickly.
Right.
Some are just, they get exposed to it and the actual bacteria themselves will start to adapt as they go,
Right.
just in small generations. It's a lot like you hear with crop sciences. You spray something with Roundup and it doesn't kill the weed because you didn't apply enough, or you didn't apply, and then the weeds get resistant to Roundup. Same idea with bacteria antibiotics for the farmers out there.
Wow. Yeah. Wow, interesting. That's a good analogy. And so it almost seems like part of that might be kind of like a natural selection process, almost like the stronger versions of these bacteria are the ones that are surviving.
Antibiotics come from living organisms, usually from mold or other bacteria. So it's a biological weapon against living organisms. They're going to adapt to each other.
Yeah.
Problem is we don't have a whole lot of those weapons left. That's
Right.
why we're being careful with our antibiotics.
Yeah, very much so. So let's talk a little bit about what Mile Bluff Medical Center is doing to improve the use and the stewardship of antibiotics.
One of the most important things we're doing is this. We're trying to educate people and help them understand that in cases in the past where they've gotten antibiotics that might not be appropriate anymore. We're starting to understand the process of infection better, the sources of infection better, and because of that, we know more specifically when we need antibiotics and when we don't, hence the whole idea of antibiotic stewardship. So we're working on education within the public and within our patient population, even within our staff, to help everybody within the staff understand their role and how best to protect patients and family members and things like that. We're also working on a lot of best practice types of things, doing the research to find out what really does happen with infectious processes and how best to attack those, when we need to give an antibiotic and when we don't. And of course the literature, it's like any other research, it's changing every day, so
right.
We're keeping an eye on that and working toward best practice to try and get to the point where we can give the best possible care right up front, minimize the patient's exposure or the community's exposure to unnecessary antibiotics, and do everything we can to optimize the care we provide. Within that, we do some tracking. We monitor to see what we are doing. As an example, the Center for Disease Control and Prevention says that 30 to 50% of all antibiotics administered in a hospital are unnecessary. Mm-hmm. Well, that was a big jolt for the entire medical community, but wow. We've set up criteria, we've reviewed that here. We know we're well above that. We're at least 93 to 95% surety that every time we give an antibiotic, it's for a legitimate purpose and it's the right thing to do. So we're watching that stuff, we're monitoring and managing to a higher level, mm-hmm. hopefully so that we take better care of the antibiotics. It's important to keep in mind that there aren't a lot of new antibiotics out there.
Right,
so
yeah.
We have to make the most of what we have, and we're trying to manage that within our organization.
Absolutely. We got to take a short break. When we come back, we're going to talk about how the stewardship of antibiotics might change the care that you get from your primary care provider. We'll be right back with more Wisconsin Doctors after the break. We're discussing antibiotic stewardship here at Mile Bluff Medical Center, part of our show, Wisconsin Doctors, and I'm talking to the Mile Bluff Medical Center panel of antibiotic stewards right here with me today. So, when we talked a little bit about what stewardship is, it's the prudent use and the appropriate use of antibiotics, when necessary, because of the development, overprescription of antibiotics has led to development of superbugs. And I want people to know that it's really, we talked about this in the first segment, that this isn't just your doctor saying, I don't want to just because I'm not supposed to. This really is a life or death situation. People, as we've talked about earlier, have died because antibiotics aren't working for them anymore. Mm-hmm. So it's really important that we all do our part to make sure that when we need them, they're there. Let's talk a little bit about how antibiotic stewardship changes the way a person's primary care provider takes care of their patients.
Mm-hmm. So, Justin, antibiotics have been given out frequently to patients because of the ease of using antibiotics and relative safety from a short duration aspect. A patient usually will tolerate an antibiotic well, but as we've been learning, there's long-term ramifications that come from use of an antibiotic, mm-hmm. such as the development of superbugs. Now, viruses, as far as causing colds, haven't really changed over time. The same cold infection that occurred in the 60s will cause the same symptoms today. But the way that we treat patients has changed. We are giving a stronger emphasis on education of the symptoms and how to manage the symptoms, and really how to avoid an antibiotic, or at least to figure out when is an antibiotic necessary. And we know from colds that most of the time an antibiotic won't be necessary for the treatment. So really the focus of treatment that patients will experience is the pendulum switch towards more conservative management and education on that illness.
Yeah, absolutely. And let's talk about some of the common illnesses that are caused by viruses, because obviously that's kind of the message here is that if it's caused by a virus, antibiotics aren't going to help you. So what are some common illnesses that are caused by viruses?
Well, Brad alluded to the common cold, and
Right.
obviously that's one that we're all familiar with. But some things that we probably don't think about, pharyngitis, a simple sore throat. 85% of the time, that's a virus. It's a very small number of patients that actually have a bacterial infection and require an antibiotic. Acute bronchitis, only about 6% of those patients actually have a bacteria. The majority of that is viral as well. And this time of the year, on through the winter, we see a lot of bronchitis. So, you know, you got that cough, you got a little bit of congestion and stuff, and it's getting down into your chest. Doesn't necessarily warrant an antibiotic.
Right.
Another one that we've commonly prescribed antibiotics for in the past are sinus infections.
Sure.
But it turns out that only about 2% of the sinus infections are actually caused by bacteria. Most of them are caused by viruses. And so the ones you got to look for are those ones that progress beyond that 3 to 5 normal
Right.
days of viral infection to something that lasts 5 to 7 days or gets worse as you progress through it, that 3 to 5 days. Then we start to worry about things. But be honest about it, even pneumonia, a large component of the pneumonia we treat is influenza, and it's viral based. So.
Yeah. Is there a way to tell the difference between viral and bacterial infection?
A lot of it's symptoms, how many days you've been sick, what kind of symptoms you're presenting with, where is the infection coming from. That's part of going to the doctor or nurse at the clinic and having them help with the examination. They can always do other things more diagnostically, like a chest x-ray or doing a nasal swab or a throat swab. So that helps to test for certain viruses or certain bacteria that might be causing your problem.
Sure. So they'll be able to kind of tell, based on what the culture results bring back, what kind of infection they're looking at, whether it's viral or bacterial. We're going to take a short break here. When we come back, we're going to talk about flu shots and why it might be important to make an appointment with your provider. We'll be right back with more Wisconsin Doctors. If you're just joining us and you're the type of person who maybe has asked your doctor for antibiotics when you've felt sick in the past, you're going to want to stick around because we're going to talk about some reasons why maybe that's not such a good idea. We've talked a little bit about the difference between bacterial infections and viral infections. Most times when someone gets the common cold or a sore throat, it's a viral cause, and antibiotics is not going to do them any good whatsoever. So if it's safe to assume that when we have common cold symptoms, that there are viral symptoms, should we still make appointments to see our primary care physician? And also, a lot of people say, like, maybe what I have is viral, but the antibiotics sure seem to work for me. So what can you say to that, Brad?
Yeah. Well, the majority of patients can manage their viral infection at home. There's a plethora of information that can be found on supportive cares. And of course, if you go into any pharmacy, you'll see rows and rows of medicine that can be used to help ease symptoms. But now there are some patients that do need to come in to have a checkup if they have cold-like symptoms. That would include very young infants should always come in. There's a lot of patients that take immune-suppressing medications or maybe have challenging chronic health illnesses such as diabetes or chronic lung disease. Typically, they should have a low threshold for coming in because they are at higher risk for complication. Now, there are patients that will have prolonged symptoms, or maybe they've been a week into their illness and they have experienced a resurge of fever or worsening symptoms. Those would be clues to coming in. Most clinics have triage nurses that could be called, and they're valuable for giving information on when they should come in. Now, historically, a lot of patients have been treated with antibiotics for viral infections. And we oftentimes get that question, well, I've always seemed to get better when I got an antibiotic for my sinus infection. Why won't you prescribe that? Well, the long and short of it is that most infections will get better whether you're on the antibiotic or not. And certain antibiotics do have some mild anti-inflammatory effect that can give an ibuprofen type relief of the symptoms. And that's where maybe most of the time where the relief is coming from.
Interesting. I never knew that it also has the anti-inflammatory effect to it as well. So simple ibuprofen would be a good way of being a good steward of antibiotics yourself then as well. So let's talk a little bit about vaccines, because every fall, even as early as September nowadays, we hear about the flu shot. Go get your flu shot, get your flu shot. Let's start out with just vaccines in general. What role do vaccines play in antibiotic stewardship?
Yeah, well, vaccines play a huge role. First of all, we vaccinate for both viruses and bacteria, so there's value in those vaccinations in terms of preventing either form of the illnesses. Also, it gives a boost to the immune system so that you get a little bit of a kickstart on certain things, especially the flu shot. We hear a lot that, well, it didn't work for me. Well, but it did get your immune system to respond, and it got you to work toward having a better immune outcome for whatever you are exposed to. It also is important because if we can prevent a lot of those viral illnesses, we can keep from weakening the immune system so that bacteria don't have the opportunities that they otherwise would. So for instance, the flu shot, even though you may get a touch of influenza, we may be able to minimize the impact of that, and by doing that, minimize your risk of a more dangerous bacterial infection.
Right.
So vaccines have a huge place in antibiotic stewardship and in stimulating the immune system, preventing the diseases that they're designed for, and then protecting the body against that compromise to the immune system from other things.
Right.
So,
and fewer people who are sick equals fewer people who are asking for antibiotics too.
right.
So there's that aspect as well. And I think it's important for people to know that when there's a difference between what people call the flu and actual influenza. Influenza is a serious thing that you don't want to mess with. It's important to get vaccinated against that. It's different from the common cold for sure. What about, are there any new developments in vaccines that our viewers should know about?
One of the big ones out right now is Shingrix vaccine, which is a newer and more effective shingles vaccine.
Okay.
So Shingrix, as opposed to Zostavax, which is the old one, a little bit more effective. It's for anybody that's 50 and older. It's a series of 2 vaccines, about 2 to 6 months apart. Although there's a shortage now because everybody's getting it.
Right.
If you miss that 6-month cutoff, you can still get it. It's just they're trying to get people caught up on that because it's way more effective than the old one.
Okay.
If you can tolerate it. So that's a big push right now we hear about. And so it's just getting it to every clinic in America because everybody wants it.
Absolutely. And really quick before we go, outside of the influenza vaccine, are there any others that folks should know about and be up to date on?
CDC right now is pushing 5 vaccines that all diabetics should get. As Brad mentioned, those are people who are more susceptible to getting worse outcomes. The flu shot is one. Also, the Tdap, which is tetanus and whooping cough. Hep B, hepatitis B. Pneumonia shot, your pneumococcal, which is the bacteria that causes pneumonia, and then the zoster, which is the shingles vaccine. Those are the big 5 that are pushing right now.
So make sure you ask your doctor about those if you haven't
need to get up to date as an adult on those.
Yes, absolutely. We'll be right back with more Wisconsin doctors coming up after the break. As we head into cold season this year, the important topic to discuss is antibiotics, when to use them, when not to use them. Believe it or not, more often than not, it's not appropriate to use them for a common cold or some of the common diseases that we catch during the winter time. So Brad, I think what we've established here is that if something goes away within 7 to 10 days, it's pretty safe to assume that it was probably viral.
Correct.
But even in that 7 to 10 day period, that can cause a lot of discomfort. So I think probably the best medicine is some prevention. So let's talk about some ways of preventing those types of diseases from occurring, but also how to shorten them when they do happen.
Sure. Well, we get back to the basics of good health for almost any condition for anyone. Eat well, get plenty of sleep, stay well hydrated. Exercise is a tremendous means of circulating your immune system to fight off infection. And then there's the big standby, which is wash your hands often. A lot of people carry those little antiseptic hand washes with them, and they work great for killing virus and preventing spread to other people. This is the same thing you can do to help shorten your illness, is just keeping up with good health. Now, there's a lot of products that people use, such as echinacea, zinc gluconate that comes as Zicam or Cold-EEZE. They have some data that shows that it may help shorten the illness. But I think just good general health living is the best thing you can do. No matter what, and no matter how healthy you are, eventually you're going to get sick. It's just the nature of the virus around us.
Well, I focus on my belief. I just believe that I'm never going to get sick, and then it just doesn't happen usually. So, no, I don't recommend that. But some of our viewers may need some help with some of the symptoms of these viral illnesses, like the pain, fever, cough, that sort of thing. What can they do to manage some of those symptoms?
The most common complaint we're going to deal with is pain.
Right.
That's usually why people come to the doctor.
You just feel crummy.
And it takes it right out of you. And certainly over-the-counter pain meds, ibuprofen, acetaminophen, naproxen, any of those are appropriate and an appropriate schedule and an appropriate dose for helping with the pain and stuff. For things like sore throat pain and stuff like that, ice chips can help, lozenges, gargles, saltwater gargles and things like that will help to ease some of the discomfort and stuff and break up some of the congestion and that kind of thing. Your doctor will have some ideas on things like other over-the-counter products that may break up some of the congestion or help to dry up some of the sinuses and things like that.
Yeah.
Certainly you can do some of that stuff over the counter without any problem as well. But certainly pain is probably the most common one. Cough, hard candy, just sucking on hard candy will help with cough. But of course a cough drop or a lozenge. Lots of fluids. I mean, that's kind of a standby for everything, but it really is an important part of getting through some of this stuff, just pounding the fluids. And of course, there's all kinds of recommendations about vitamins and things like that you can do, but the reality is, the basic pain meds, the simple stuff like the ice chips, the lozenges, a humidifier to break stuff up, those kinds of things.
That always helped my kids, having a humidifier in the room. That was like a night and day experience. They'd be coughing and coughing, and as soon as I turned that humidifier on, it would literally just stop, or if it didn't, it would become more productive, which is what we want, obviously. So if I have a virus, what are some things that I can do to protect my family and friends and coworkers?
Yeah, when you get sick.
Yeah.
As Brad mentioned, some of the simple things you would do to prevent yourself from getting sick or helping will protect the others around you. Don't want to get your other family members and other coworkers sick. Washing your hands, probably the single biggest one, whether it's actually washing with warm soap and water or just using hand sanitizer when appropriate. And sitting next to somebody sick isn't going to make you sick, but it's spreading the thing. So covering your cough, if you blow your nose, don't immediately shake my hand.
Right.
Things like that. Things that I teach my 3-year-old not to do. Don't cough and then touch stuff. So you might need to wear a mask, especially if you're very productive. That may not be as important for protecting the spread as just comforting everybody else.
Right, absolutely. Yeah, important stuff. If viewers have more questions about this, can they go to either your website or the Center for Disease Control website and find out more information about this stuff?
Center for Disease Control has a bunch of stuff. I mean, and you can pretty much put in your symptoms and it'll bring stuff up for you to help you out. So
awesome.
Yeah.
Great resource.
Yeah. Well, Craig Griffiths, Nick Hewitt, and Brad Ingram, thank you so much for joining us today and for the information. And I hope that you can continue to be a good steward of antibiotics as well this season. From all of us here at Bluff Medical Center and Wisconsin's 57, we invite you to live longer, live better. We'll see you next time.